Here are 7 boring treatments that can actually prevent hip replacement surgery. And I say boring because we have so many cutting edge treatments out there, so many new procedures, so many new techniques, a lot of new different injections and medications, but they're focused on treatments that don't solve the root problem. Some of the ones that are out there are like injections when it comes to hyaluronic acid. This is supposed to mimic the fluid inside of a joint. There's new concoctions being made, new products being made when it comes to hyaluronic acid, PRP injections, which are platelet-rich plasmas, stem cell therapy. That's all brand new stuff that's in development and cutting edge. And it's marketed in such a way that it seems like it's the next big breakthrough. And it might be, but currently it's not solving hip arthritis. The other big one is robotic-assisted, minimally invasive hip surgery. This is a thing that people are using to treat hip arthritis. But none of these treatments solve the core root problem that truly take the pain away, that truly change the forces inside the joint so that you can have a normal experience afterwards. And so when it comes to fixing the root problem, which is what I specialize in, there's some really boring things that you just have to do. And it gets to the point where I have people saying, all right, I did it all. What do I do next? And I just say, do more. It's as straightforward as that. Number one thing, boring, using a walker and crutches. I say using a walker and crutches because a cane can offload your hip, but it might not be enough. You might get away with a cane. But if you can offload your painful hip by leaning your weight through your hands on a walker or some crutches, and you spend all the time that you have to walking, whatever you have to do to walk throughout the day or stand throughout the day, if you change it to standing and leaning on a walker or a crutch, you will feel tremendously better. And getting the pain down by doing this is going to set you up to do other aspects of treatment that can help fix the pressures and solve the root problem of hip arthritis. But it's boring and it gets old fast. People complain all the time about having to lug the walker around or the crutches fall. You can't stand them up anywhere without them falling at least twice throughout the day. The canes fall too. You have to do this though. I make it a required part of my hip arthritis recovery program because it works. It just gets the irritation level down. Crutches will cost you $20, $30. You could probably find them even cheaper at a thrift store. People throw them away because they only need them for a short time. But people have all these hang-ups about, well, if I pull the walker out, I'm going to get all these questions, right? Your friends, your family, what happened? Are you okay? And in the long term, who cares? If your hip's better, if you're doing the right thing to make your hip arthritis better and you can avoid a hip replacement surgery, just go through it. On the short end, you're probably going to need it for a month or 2, maybe 3 at most, as you work into the other parts of the treatment that are going to heal your hip arthritis by fixing the root problem. So you're not worried about doing some cutting edge treatment that only gives you short-term relief. Number 2 is glute activation. What I mean by this, it's really simple. Right now, you can do this. Tighten your glute muscles wherever you are. If you're sitting, standing, lying down, any position you're in, just think about squeezing your glute muscles, like making them tighten up on their own. If you tried it and you felt your thigh muscles working on the front or the back of your thighs, or in some cases people's lower back muscles are working, that means you have a massive imbalance. And the way to fix it, it's not hard, but it's not also terribly easy. It's straightforward is the best way to do it. You need to just tighten those glute muscles and practice it and practice it and practice it. I tell people going through our treatment approach, you need to do it every hour, every half hour if you can. You need to be obsessed about doing it because the more reps you can get in, tightening your glutes and training your body, training your nerves to just get rewired and make your glutes work when you want them to, rather than trying to make your glutes work and all these other muscles fire up. If you spend time with your other muscles working, with the compensations happening, then you're just stuck in having hip arthritis because if your glutes can't work, your hip joint can't work right. But if you can force your glutes to work right and have conscious control over them, then you're in a position to take control over your hip arthritis situation. It's not an age-related problem. It's a how good can I control my glutes problem. Number 3 is massaging your thigh muscles. Now, you could do it with your hands. You can get one of those fancy massage guns, but freeing up these muscles right here on the front, all the way up to the hips right here where the hip flexors are, is critical at the beginning, especially because how many times has it happened to you where you've been sitting for a while and then you go to stand up and this just feels stiff and tight on the front? It feels that way because those muscles are part of your muscle imbalance. They've been compensating for those weak glutes in the back. And so they've been shortening. They're overactive. They want to fire all the time because they like to compensate. And so when you sit for long periods of time and then you stand up and you feel that stiffness inside your hip joint, that discomfort in the groin area, right where your thigh meets your body, but on top of that you feel stiffness in the muscles right here, it's because those muscles are so stiff. They're not letting go, and that extra little bit of contraction they're giving you all day long amounts to compression inside the hip joint that just promotes hip arthritis. And so if you can go in there and free up the muscles on the front of the thigh, all the way up into the hip flexors, you're going to feel less stiff. Now, this is not a long-term solution, I have to be honest with you, but it's setting you up to use your glutes better, to not be so dominant with your hip flexors and thigh muscles in the front of your thighs. So if you can massage them on a consistent basis, I tell people every day, several times a day, morning, noon, and night is a great schedule. More than that, if you feel like you can, and it doesn't need to take a long time, don't spend more than 5 minutes doing it, you'll feel much better instantaneously. The fourth boring thing that you need to do is abdominal strengthening. People ignore it all the time. They don't want to do it because it's challenging. You don't want to do your abs. You have to lie down on the ground. Some people don't like to get down on the floor. You have to make muscles burn that you're not used to making burn. And then it's confusing. Some people can't get their abs to work just right in the right way. We make it straightforward in our treatment approach. In the hip arthritis recovery program, we detail how to get these lower abdominals to work right consistently, because that's what needs to happen. If you can get these lower abdominals to work for you the way that you need them to, then they give your pelvis bones tons of stability. And you need that because on the backside of your pelvis bones is where the glute muscles live. And those glutes are all too critical at getting stronger so that you can get the position of your hip bone right to reduce the bad pressures in your hip joint that are leading to hip arthritis. But you've got to do the work. Every day, you've got to make your lower abdominals burn. It's uncomfortable. People don't like to do it. But what's the alternative? Would you rather have a hip joint replacement because you didn't do the abdominal exercises and the glute exercises and other exercises that are boring, but you got to do them? Because if you do have a hip replacement, guess what? That abdominal strength is not going to be any better after you go through the surgery. Your glute strength's not going to be any better. And even though you have a brand new joint, ceramic or whatever metal they're using these days, you still have all these other tissues in your hip, all these other muscles, all these other nerves that can be influenced by the muscle imbalance and generate pain. And this is what we see. People that have failed hip replacements where they still have hip pain afterwards, they'll go to the doctor will, the surgeon that did their hip replacement will do the x-ray, and then they'll say this, everything looks fine. My surgery's holding up perfectly. And they're not wrong. They did their part. And unfortunately, they have to let you go at that point and say, I don't know what it is, because everything I did is working just fine. But the thing is, they're not aware of the muscle imbalance. That's why I'm here telling you this. You need to fix this muscle imbalance. And so getting the abdominal strong, the glute strong, and calming down those muscles on the front of the hips and thighs are critical. And it's boring, but you got to do it. Number 5 is toe curls. Toe curls means you're curling your toes. These muscles that help your toes bend down send tendons into the arc of the foot. And when they're stronger, you have better arc support. When the arch of your foot is well supported, then it supports your shin bone down here, your knee joint, your thigh bone, and it assists your glutes. It makes the work less on your glutes so that you have better pressures in your hip and your knee. It's not uncommon for people that have hip arthritis to also have knee problems. And that's another reason why working on the toe strength is so critical, because we want your knees to be great too. We're not just taking care of the hip alone and separating the knee as another problem. That's what medical professionals often do. You come in for your hip, and if you mention, my knee kind of hurts too, they say, oh, that's for another day, that's for another visit. You'll have to schedule another appointment. We can't treat that right now. doesn't work that way. The body's all interconnected. We need to look at it as an entire unit, as the way that one joint affects the other joint needs to be considered. That's why the foot is so important for the hip joint. But what's required of you is when you're sitting around, you got to slip off your shoes and curl your toes in a way that doesn't hurt and hold it and make those muscles stronger. And then you got to learn how to do this while walking, which leads me to the next point, number 6. So many people scoff at me when I have them here in the clinic and I tell them we're going to go out into the hallway and we're going to practice how you're walking. And then some say, "Are you serious? I know how to walk. I've been walking since I was 1 year old. Haven't stopped since. Yeah, it hurts me to walk, but I can walk." I didn't know there was anything to it. And we break down which muscles you should be using during the walking that you're not. It's often the toe muscles, definitely the glutes, and usually the lower abs as well. And you need to practice using those muscles in the right sequence at the right time so that your hip joint can be happy. And what's happened leading up to this point is the sequencing has been all off because you're so compensated that your body just figures out a way to walk, but to its detriment. It's actually making the pressures in the joint bad. And so walking becomes a harmful thing for you because you're using the wrong muscles to do it. You're still accomplishing it, but in a way that's not good for your joint. So we need to reset that. And if you can practice walking the right way, which takes conscious thought, you have to feel like a robot for a minute and think about your foot muscles and think about your glutes and make sure your abdominals are working the whole time. But after you practice it for a day or two, sometimes a week or two, and it can become the way that you typically walk, your default walking method, then walking can become helpful for you rather than harmful for you. And then it's okay to go on long walks as long as you're using the right muscles because your hip joints are going to love it. Hey, I want to interrupt the video really quick to tell you about our hip arthritis recovery program. This program has 3 major components in it that you can take advantage of. One is it's got a curriculum. It tells you exactly what to do to heal your hip arthritis, to go from not being able to walk, having pain in the mornings, stiffness in the mornings, fear that you're going to have a hip replacement eventually. It tells you all the steps in the curriculum, but then we've also got coaching. You get group coaching that's live with me and my recovery coaches, plus you get into a community of other people that are on the same journey as you, trying to avoid having a hip replacement and getting back to doing the things that they love to do. Learn more about this program, the Hip Arthritis Recovery Program, in the link below here in the description. Back to the video. Number 7 is mini squats. As soon as I say squats to somebody who has hip arthritis, they start saying, this isn't for me, I can't do it. The doctor told me not to do that. I have a hip replacement on this side, I'm just trying to get this. They start giving all the excuses as to why they can't squat, and I have to redo the picture in their head about it because I think that they're visualizing bringing their bottom down to the heels, almost to the ground, and holding 100 pounds of weight while doing repeated squats, and that's not what I'm saying. Mini squats is what I'm saying, and all that means is in a standing position. And the prerequisite to all this is that you know how to fire these muscles I've been talking about, the abs, the lower abs, the glutes, and your foot muscles. If you can do that, then you can move on to mini squats. And you have to be able to fire those muscles well. You have to have good conscious control. You have to have confidence that you can do it well on command. Then we can go into mini squats. And all we're doing is slightly unlocking your knees and dropping your bottom an inch or two or less. And then holding that position while constraining your body to use the right muscles, the ones I've talked about. Because then it teaches your brain and all the nerves that connect to your muscles, this is how we need to move. And if you can do that on a consistent basis, that's good quality motion for your hip joints. It's offloading the joint actually, because you're using the glutes now. Then it's helpful for you. But it's boring to stand there and do a mini squat. But the patients that do the best through our program, the ones that cancel their hip replacement surgery, the ones that get back to hiking, walking as much as they want to, exercising, even lifting weights, even some serious weight, they're practicing using the right muscles. They're practicing mini squats. They're doing all the boring stuff. Because that's all it is. You need to just do the boring work to get the massive successful results and avoid hip replacement surgery. Hey, if you want to get more details about our treatment approach for hip arthritis, check out this video right here.